Hello all, my name is Daniel Madden, and I am pleased to present my work, Constant Pressure of Having to Perform, Exploring Player Health Concern in Esports, done under the supervision of Casper Harteveld. Before beginning, I'd like to thank the CHI Conference for the opportunity to present today and for the honorable mention. To understand our examination of esports, we use the following definition, the umbrella term for organized competitive digital gaming that has taken on the aesthetics of professional sports. Within this definition, we can understand that competitions, routines, and training regimens of these players reflects traditional sports. Because of this, we began to ask the following question. What are the major health concerns in esports? To answer this question, we conducted a two-part investigative study. Part 1 was a series of semi-structured interviews carried out with professional esports players to develop an understanding of the key health concerns and experiences in esports. The information gathered was then used in Part 2 of the study, a survey administered to a wider esports audience of players. For Part 1 of the study, 10 esports professionals were interviewed. The participants included 8 male and 2 female gamers, with an average age of 25.8 years and 4.67 average years of competitive experience. These participants competed in a variety of games, including StarCraft II, NHL 2K, and League of Legends. The interview questions were divided into 4 main categories. The first 3, daily routine, physical health, and psychological wellness, were developed based on previous literature. The fourth area of investigation, support, was added during the interview process as players continued to mention a lack of official resources. Instead, they relied on friends, family, and other networks for mental and emotional support. A thematic analysis of the interviews resulted in the first draft of our health and esports model. As the image shows, each theme can be broken down into sub-themes frequently mentioned during the interviews. This model reflects the biggest concerns in health identified by the players. However, the model does not show how such concerns may relate to one another. We developed a survey administered through various online communities to begin understanding how factors in the model related to one another. The themes in the survey were consistent with the themes used in the interview process. Because of the concerns of the participants in the interviews, special attention was given to psychological wellness. Previously verified instruments were used to determine levels of overall mental wellness and perceived stress, while additional Likert scales were used to determine the relationship different support networks may have on negatively or positively impacting a player's overall mental wellness. In terms of physical pain, responses were consistent with previous studies. Wrist pain, back pain, and general eye fatigue were among the most common injuries players experienced. Examining mental health, 40 participants experienced symptoms of depression or anxiety related to esports participation. However, only 1 considered seeking professional support. This may be because of a lack of support options provided in current esports communities. Among survey participants, the highest perception of support came from the team members, not from professional resources. We used the data gathered in the survey to carry out a correlation analysis to begin understanding how the identified health factors affect one another. Stress is a major focus in the model as all interview participants and survey participants reported stress. While the cause of their stress differed, all players felt the negative impacts, especially from stress they inflicted upon themselves. Additionally, we begin to see how various members of the community and a player's support network may positively or negatively impact stress and mental well-being. While the results show both physical and mental health needs improvement in esports, the player's primary concern is on their mental health. Almost all players experience stress due to their involvement in esports, leading many to experience symptoms of anxiety, depression, and burnout. Despite this, players had little to no resources to manage their mental health in the organizations they participated in. Adapting social emotional learning and mindfulness practices for esports may provide players and members of the community with tools and knowledge to mitigate the stress and other factors negatively impacting their mental health. Community education may also be used to aid players' support networks, such as friends and family, to understand their impact on players. The HCI community may begin to develop new designs for esports viewership, tournaments, and online play to create greater human connection and experience that is, quote, virtual and isolating.